Okay, so I think we left off here. Um, so we talked about the effect of blood viscosity. Because I remember I got this backwards at first. So remember, if you increase the viscosity of blood, that increases the resistance to flow, makes it harder to flow. Total blood vessel length, we have sort of the same relationship. As you increase the length of the blood vessels, it increases resistance. And we did blood vessel diameter. This is a big one. I know it's bold there. But remember, the arrows went opposite way here, however we set it up. So if you would increase the diameter of a blood vessel, it decreases resistance. It's easier to go through a big tube. Or vice versa if we did the arrows that way. If you constrict a blood vessel, it makes it smaller and it's harder to go through that tube, so it would increase resistance. All right, so I remember doing that. And then blood... I don't remember if we did this or not, so I'm going to say we didn't. And if we did, then just zone out until we get caught up here. But so blood pressure in the systemic circuit. Remember, arterial blood pressure here is high and pulsatile. And then because of systole and diastole. So the reason you have a top number or bottom numbers, remember, I think we did this. So when the left ventricle contracts, that gives you your systolic pressure, that's systole. And diastolic pressure, your bottom number when the left ventricle relaxes, diastole. And here's where we quit. So the role of the aorta and the other elastic arteries. So remember we said that it smooths out blood pressure. Here in a minute I'll show you a chart that would kind of show you what blood pressure is like in the heart, and it's pretty different than in the aorta. We're going to go through these pretty quick because we did this in lab, and you guys did, and you dwell on it, and so I don't really think we need to cover it really much more. I'll just remind you, but some important related terms where we did pulse pressure, and you guys had to calculate that, but remember that's the difference between systolic and diastolic, so you subtract. So if remember we did, just to make it easy, if it's 120 over 80 is your blood pressure, the difference between 120 and 80, 120 minus 80 is 40 millimeters of mercury. That'd be your pulse pressure. So subtract systolic minus diastolic gives you pulse pressure. And that's what you feel as someone's pulse. Hey, for this, places where you can take pulse from, and we're gonna add one on here that I forgot that for you nursing folks, which is most of you, this is an important one. We need to find a picture in your book, and I didn't bring my book home with me. I forgot it. So you guys find. Here, I'm going to move this around a little bit. There. Find this. There's this picture or one really. It's pretty similar to this. It's in the blood vessel chapter. So go find that, and then we'll write down this. Here, I'll kind of go back and forth. The one I was gonna, we got a little bit of room right here. So the one I was gonna add was the one that's on the top of the foot. Do you guys know that one? That one. Well, here I think you can still see it if I keep it over here on the side. It's the dorsalis pedis artery right there. You can see it. Dorsalis pedis. Oop. There's another one I was going to add on there, but posterior tibial. So that's the one you feel by the medial malleolus there. And that's something else I'm going to show you. Okay. Jaw by the mandibular angle. That one, facial artery right there. Jaw by the mandibular angle. So right, facial artery. Let me see if I can zoom this up a little bit. I don't know how visible that's going to be for you guys. Is that better? And then neck. That's going to be common carotid. Here, it says carotid artery right here. Go ahead and write common carotid. Arm. I bet you guys already know that one. Remember, the arm's going to be brachial. Wrist. You guys probably know that one too. Oop, where's that? Right there. There's your radial. And back of knee. Remember the word for that? If you didn't see it before, yep, there's popliteal right there. Popliteal. So all those are important. It shows some other ones on here too. There's the posterior tibial I mentioned a little while ago. Oh yeah, the temporal artery too. You know, it's a branch of the external carotid. So is the facial. But hey, so all of those are arteries. Artery, artery, artery. Why can't you feel the pulse in a vein? Because there isn't one. Pressure is not pulse style. Here, let me actually go ahead and write this in here. Right here, write that. Pressure is not pulse style. There's not a top number and a bottom number in the blood pressure. There's just a single number. So if there's just, like a blood pressure in the brachial arteries, like maybe 10 or something, if there's not a difference between systolic and diastolic, there's nothing to feel as pulse. All right, so check this out. Where I'm going to, this shows up on your test, but we did it in lab. Remember that mean arterial pressure map? Or mean here means, it's the average blood pressure over like a period of time, like a minute or something like that. And remember when we calculated it, you take your bottom number, your diastolic, and add that to pulse pressure divided by a constant of 3. So why isn't it, so if your blood pressure is 120 over 80, then you might just think, well, what would average blood pressure be? 120 plus, if it was just two numbers, like it wasn't blood pressure. If you're just figuring out what the average is, 120, 80, you add them together and you divide by 2. So it would be 100. But you can't do that with the heart over a period of time like a minute, because systole and diastole wouldn't, like over a minute, wouldn't each occupy 30 minutes, like your heart, 30 seconds. So your heart wouldn't be contracted for 30 seconds and relaxed for 30 seconds because of this. So here's what you want to write down here. Diastole relaxation lasts longer than systole. So heart relaxation, I think we mentioned that when we talked about heart sounds and the S1 and the S2. I thought it. I don't know if I mentioned it. All right, so heart relaxation lasts longer than contraction. So pretty much over the course of a minute, about a third of the time the heart's contracted, and about 2/3 of the time it's relaxed. I think that's pretty much where that 3 comes from right there, that value. All right, blood pressure in capillaries and veins. Here's where I need you guys to find another picture in your book. It's not, let me move this over here a little bit. There you go. It's not exactly that, but it's really dang close. You don't have this part over here with the heart. Yours starts in the artery. Other than that, it's the same. But while we got it here, check out blood pressure here in the left ventricle. So no, it goes pretty crazy up and down from 120 to like 5 or so. You got a lot of variation in pressure right here. But remember we talked about how the elastic arteries help smooth out blood pressure. So here, check it out once we get into the aorta. It's reduced quite a bit. There's still a pulse there, but look at what happens as we go out towards the capillaries. So blood pressure starts to drop, and you start to lose the pulse. So it's going to ask for blood pressure in like the capillaries here in your notes here in a minute, and it's going to ask for the veins. So in the capillaries, on the artery end, you're going in about 40 millimeters of mercury. On the vein end, you're coming out about 20 millimeters of mercury. So we're going to shoot the middle. We're going to call capillary blood pressure about 30 millimeters of mercury. So I was guesstimating a little while ago. I said, hey, in a vein, make your brachial vein or something, maybe your blood pressure's like 10. And it doesn't really tell us where we're at on here, though. Here's the right atrium. Here's back at the heart. So this is going to be your vena cava, your superior inferior vena cava. I don't know, what's that going to be like? About 5, something like that, about right there where the bottom of the pressure sitting inside the heart. And note, in the right atrium, blood pressure is 0. There is probably even a little negative, maybe a little suction during relaxation. So blood's still high to low, it's still flowing in. But anyway, here in the veins, way low. And note, not a top number and a bottom number, just a number, just 5 or 10 or whatever. Okay, so yeah, definitely find that picture. Definitely. And let me find my notes. Okay, here we go. Back to the notes. Average blood pressure. Okay, so what we're just saying, what we just saw on that chart, average blood pressure in the capillaries is dropped to about, go ahead and say 30 millimeters of mercury. So 30 mmHg right here. And like we saw on the chart, pressure continues to drop as we go back to the heart and the veins. Okay, so by the time blood reaches the superior and inferior vena cava, remember we're guesstimating a little bit based off that chart, but what, it was about, say, 5 millimeters of mercury? Something like that. Call it 5. You might want to say, put the squiggly equals, say, about 5 millimeters of mercury. So pressure's low in veins, and veins need a little bit of help getting that blood back. And here's some stuff that helps. Like we mentioned, the valves. And remember, every time we run into those valves, it's going to keep something from going backwards, their blood. So it keeps blood from going backwards, so it doesn't, well, here, it says it keeps blood from going backwards, but it doesn't actually propel the blood forward. So it keeps you from losing the ground, but it doesn't help you gain. This is what's going to help you gain. What helps you move blood forward? All right, two things. Muscular pump. When any muscle contracts, it bulges. So when that muscle bulges, it squeezes veins in the area. And as those veins get squeezed, it's like a toothpaste tube. You know, you take the cap off the toothpaste tube. It can't go backwards. It's only got it one way to go. So when you squeeze it, the toothpaste comes out. The valves keep the blood from going backwards. So when those muscles contract and compress the veins, it's got to move towards the heart. That's the only way it can go. So this is for muscular activity. So if you're up and walking or something like that, you've got better blood flow in your veins than if you were just like sitting there in bed or something like that. The action of the muscles help move that stuff in there. I don't think you really need to add anything else to that. But okay, so here, respiratory pump for veins that are in the thorax and in the abdominal pelvic cavity. It says inhalation increase, especially in the thorax, but abdominal pelvic cavity too, to some extent, I guess. But as you inhale, it increases pressure in the chest cavity and down below a tad, and that does the same thing. It compresses veins. But here it says this is still muscle, because remember when we breathe. Here, I'm going to copy and paste something. Remember the muscles we use to breathe. Oops. Let's pop it in here. Oops, wrong one. My bad. Oh, well, here. It's the diaphragm. The diaphragm. Let's go and write the diaphragm. And, or the muscles that are in between your ribs. Intercostals. Especially the external intercostal, but internal helps too for forceful breathing. All right, blood pressure in the pulmonary circuit. Remember, systemic circuit is heart, everywhere but the lungs, and back again. Pulmonary circuit is heart, lungs, back again. It's a lot lower. So arterial blood pressure in the pulmonary circuit is much lower than it is in the systemic. It still has a top number and a bottom number. I'm just going to go with the value in your book. So it's about, I wish I had a little pencil I could write here, but it's about 25 over 10. So about 25 over 10 millimeters of mercury. That's a decent arterial pulmonary circuit blood pressure. All right, and we're at the 13:30 minute mark, and I think that's where we're going to hold off. All right, so that's it for this video.